You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you've enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you. Hello, this is Richard Jacobs with the Future Tech Podcast. Today I'm talking to the Chief Growth Officer of Evoke Giant. His name is Eric Steckelman. So Eric, thanks for coming, and how are you doing today?
I'm doing great. Thanks so much for having me.
Yeah, so tell me, it's kind of an unusual name. Where does the name Evoke Giant come from, and what's the premise of the company?
Sure. So the name Evoke Giant is the consolidation of two agencies brought together through an acquisition which occurred within the last 6 months, I believe, specifically bringing in the power of a larger network of agencies, specifically Evoke, part of the Huntsworth Health family of agencies, and being able to leverage the great work that Giant Creative Strategy, which we were formerly known as, and bring that forward. So we've obviously been able to expand not only from a geographic perspective, but through the ways we're able to provide value and engagement with our clients today.
That makes sense. And what's the goal of the new merged company? What do you guys recommend?
Sure. Well, the aspect, what we do is we are 100% health and wellness focused. Everything that we do, every engagement that we focus on is really within the healthcare sector. And that could be from, helping to support pharmaceutical, biotechnology clients, as well as diagnostic and medical device clients, but even going further, looking at ways of engaging within the healthcare space, which is quite varied and goes beyond the 4 verticals as I shared. Health and wellness extends much further, and there's a tremendous amount of opportunity out there.
So you're working with large enterprises to help them connect with customers better, or are you helping individuals to get services and connect with their own services better? What are some specifics?
Yeah, absolutely. Thanks for clarifying. So the way that we engage is as a healthcare-oriented marketing organization, we do work with clients big and small, enterprise-wide as well as emerging and startup, to help set their commercial objectives and to help them go to market or maintain their market advantage through a myriad of different ways from within the marketing funnel. And that could be everywhere from helping them strategically how best to connect with their customers, whether it's a consumer or patient or a physician or a payer, for all practical purposes, but more importantly, bring forward those efforts to help to drive their brand forward and to establish greater brand equity and, of course, brand loyalty, like with any other brands that we would see specifically within the more traditional consumer packaged goods, for example.
So what are some of the brands that were attractive or interesting to you, and what kind of things did you do with them?
Well, I think what's really been really exciting is that we've worked with a lot of brands, big and small, as I mentioned, and you can see that we work with clients such as big pharma, like we work with organizations like Amgen and Genentech. We also work with smaller clients as well. For example, device and diagnostic clients, where I think actually like an organization like Verisight recently that had the opportunity to partner with Johnson & Johnson, we had done work with them about a year ago to help to launch one of their assets into the market, specifically within the diagnostic space. And as we see a shift towards more personalized medicine, how can we take the opportunity to start to evolve our efforts to target organizations and support their efforts as they're looking to help to solve some of healthcare's most difficult challenges, which in some instances could be diagnosis, or many of the areas that we do work are specifically within brands and obviously brand management as well.
Do you have any examples of a specific project that you thought was, just a lot of fun to work on or had an impact that you enjoyed? Any specifics?
Yeah, I think that there was one project specifically that we had the opportunity to work on as an organization, which back when, it's a little bit dated, but a couple of years ago we had the opportunity to work with an organization called Cancer Research Institute. They're located in New York, and they had received an unrestricted grant from a pharmaceutical company in the effort to help to educate both providers as well as consumers and patients around what is cancer immunotherapy. I think the velocity of innovation that we're seeing in healthcare today is testament to this example, because at that time, which was just candidly a very short period of time, very small in terms of time frame when we had the opportunity to engage a few years ago, and they needed to educate as they were getting ready to launch efforts for their organization that they were partnering with, specifically around cancer immunotherapy. So we had created a campaign known as I'm the Answer to Cancer. And one of the things that we had done with that is that we harnessed the power of not only the provider and their perspective, but also the patient and what they thought and how they needed their education to overcome some of the challenges and awareness aspects of cancer immunotherapy. And we created this program called 30 Stories in 30 Days, and we launched it at a time when one of the premier medical conferences, which is known as ASCO, the American Society of Clinical Oncology, was coming around. And it was able to show a perspective every single day of what cancer immunotherapy means to either a provider, a nurse who might be managing clinical trials, a patient, again, many different types of patients as they were looking at different tumor types. And the campaign was very exciting. It obviously rolled out huge social media presence with it as well. And it was quite successful in terms of helping to set the stage for what we see today as a very dynamic marketplace, specifically around cancer immunotherapy.
Okay. Any particular results that came out of the campaign that, were important to you? What were some of the goals of the campaign?
I think that with every campaign that we work on, we do set specific objectives and goals, or what we see or commonly hear as KPIs or key performance indicators. And in this particular situation, it was about engagement and it was also about education. And I think that we were absolutely able to do that, as we saw through our social media aspects, and obviously being able to track the data and the penetration of the content externally. But I think more importantly, we were able to establish a fluency around what does cancer immunotherapy mean, and moving forward in the areas that we need to be focused on. And that to me is something that I think is really exciting, is when you're able to take something that's relatively nascent and start to actually be at that sort of that dawn of being able to change the conversation and to drive it in a way that's going to ultimately be better for all parties involved. Ultimately, at the end of the day, the patient.
Okay. Oh, go ahead. You said ultimately at the end of the day, the patient what?
I was saying that ultimately at the end of the day, everything that we're doing is about the patient. And so when we are doing any campaign effort around, whether it's targeted towards a professional audience or a patient audience or consumer, it's really ultimately to better patient care at the end of the day.
That makes sense. Okay.
And that's the vision of our organization as well.
Oh, go ahead. You can say more about that.
Yeah, our vision is ultimately to try to elevate marketing communications so that they're perceived as essential to the outcomes as individual products themselves. And by doing that, we think that we're able to create, a deeper, more meaningful engagement with our customers, so that we're able to achieve that vision and actually not allow that to be so lofty, but in fact actually use that as our guiding post.
Gotcha. Okay. So what's different about or different or uniquely challenging about marketing in this space versus others? What have you found?
Well, I think it goes without saying that the healthcare marketing space is there are some inherent, I wouldn't say challenges, but I would say there are opportunities. You're working in a much more heavily regulated environment. And I think that just being familiar and fluent in what the regulatory requirements and the parameters that you're able to be in or that you must work in, they do create, so I wouldn't, again, as I mentioned, not necessarily challenge, but, sort of more guardrails, so to speak. But obviously, what we're doing is trying to sort of push where we think that we can. And the great part is that the regulatory bodies have actually even been, pushing regulations that are somewhat favorable, even looking at medical device classification in terms of the regulatory environment, how social media is being leveraged, is obviously being much more appreciated and understood from a regulatory environment. So I think that, what might have been a thought 10 years ago experientially and how we communicate with our customers, we're now able to start to see that, for example, be realized. And I always say that sometimes, even though technology came out or was pushed out at a time and it wasn't successful, doesn't mean that it's not a meaningful or winning technology. It may not be right for the time or within the market that you're actually going after.
Well, any examples of some of the regulations that affect healthcare marketing that don't affect other industries? Any that you can mention so they understand what that means?
Sure. Well, I think what's fascinating is that, as everyone I'm sure is aware, that the FDA, for example, is one regulatory body. It's a federal agency, and it is very strict with requirements in terms of, for example, drug approvals. And they're also very specific around what you can say or what you cannot say when you talk about your product, for example. So unlike a product, say, like Band-Aids, and not to call that out necessarily, but that's a brand that everyone pretty much knows. You can walk into your local pharmacy and see Band-Aids, and people, it can be talked about in any which way. But the point of the matter is that it's able to it's less restrictive in terms of some of the messaging or the communication guidelines that you're able to talk about. Unlike with a brand that is regulated by the FDA, you are mandated to stay within sort of the guidelines of your approval or the data that was used to approve that product, and not to try to make extrapolations. So that was seen as somewhat as false and misleading. So you want to be obviously ensuring that you are providing accurate information, but of course, as marketers, you do want to try to make it engaging and meaningful, and so that does require, some savviness and somewhat skill to make sure that you're able to elevate the brand in a way that is still beholden and aligned to the approval that the regulatory body has set forth.
So, for instance, if you had a product that made skin smoother, but it also seemed to reduce blisters, but you were only approved to talk about the skin smoothening part, you could say that, but then you couldn't say it may help with blisters. You'd have to stick to what you were approved for only.
That's correct. And so from the organization perspective, and we're basically working as a surrogate or in partnership or an extension of the organization that we work with, exactly. We would only be able to work with them on those communication strategies that would really be around that skin smoothing aspect. However, that being said, as the end user, or in this instance it could be a dermatologist, may notice that it also helps to work for blisters, they're able to use their license, their medical license, to use products what they call off-label. And that's based upon their own experience and sometimes evidence, which may be and has been a little bit, I don't want to say in conflict with, but sometimes it's a little bit ahead of maybe where the initial experience comes from.
How narrow are the approved uses for products that you've seen? I don't know, an antibiotic, for instance. Like what would?
Yeah.
What would be said about an antibiotic, just for instance?
So an antibiotic, so it could be broad spectrum, for instance. But the question would be, is it for what type of organism? So, for example, as opposed to just prescribing it for all comers, because we know that obviously is contrary to sort of how we practice medicine today, in the fact that you want to ensure that you're being as targeted as possible with antibiotic therapy, so that you're able to target the right, pathogen or microorganism. In this instance, you typically would approve it for, or the organization like the FDA would approve an antibiotic for a specific type of bacterium, like a gram-positive or gram-negative, or some specific type of organism. And so, therefore, it would not be able to be promoted from a marketing standpoint for those that are beyond the indicated organism, even though it may have been shown in the clinical arena to have benefits beyond. In order to obviously expand that label, you would need to obviously do randomized controlled trials and clinical trials, and then to obviously add that into the label so that ultimately it would be able to be used from a marketing standpoint later downstream.
So is there a feedback mechanism? Let's say that example I gave you of smoothing skin and helping blisters. And, you're helping a company with smoothing skin, and they're getting feedback from, all these dermatologists, hey, it's helping with blisters. Would you then tell the company, maybe you should try to get some clinical trials going, because if we can get the blister angle included, that would really help your marketing and your brand?
Yeah, it's a couple. I have the luxury of having to have been working at the manufacturer side before in my past life, so to speak. I actually would say a more relevant example, because it's one that actually exists in the world today, is minoxidil. We know of that because it obviously we talk about it as a key ingredient of Rogaine, and that's used for hair growth. But what many don't know is that back in the 80s or around that time frame, minoxidil was used to treat blood pressure, for instance. And through that blood pressure aspect, they found that there was an incidental side effect. It happened to grow hair. And so through that observation in the community, there was the intent of, obviously, I don't remember who the manufacturer was that brought that to market, but they looked at the ability of that drug to be studied in other aspects of healthcare. In this particular situation, it was male pattern baldness, and they saw that it worked for a subset of patients and were able to get approval for that. We see that in other drugs as well. We saw that with another drug that was used for prostate health that was shown to also grow hair as well. Sometimes the dosage is a little bit reduced, but the point is that they're seeing incidental side effects, which could also be used for other benefits or other areas within the healthcare space. But of course, those were all leading to clinical trials. Those early signs led to the clinical trial programs, which ultimately led to the ability for those products to come to market in different indication uses.
The size spurling of the hair club for men probably had good blood pressure in addition to hair in his head.
Yeah, very funny. But I mean, I felt it was a relevant example, just as we were talking about skin smoothing, but also helping with blisters. There are a lot of drugs that ultimately have other areas of opportunity, and I think that's great. I mean, they're chemical entities that, especially when they're given systemically, it's not uncommon that you would find, all side effects are not necessarily have to be negative. Yes, of course, there are adverse events, and that necessarily means that they are potentially negative. But as we just showed, there are those that can potentially be a benefit. And then the question really is that benefit warranted to support a clinical trial program, which, by the way, happens to be, a huge expense, but there is the potential that obviously it would be able to be used and promoted that way in that environment.
So how do you guide your customers, and where do they need guidance? Do these brands already know, we want to expand what our brand can do and we're gonna, they tell you what they want to do, or is it you guiding them and saying, hey, here's what's happening in the market, here's what we suggest you do, or you take this direction? What does it look like, that interaction?
Yeah, that's a great question. So, we as a full service marketing communications agency, we work with clients at all aspects of the life cycle. And not only from a life cycle in terms of a drug's approval, and where they are, whether they are launching or whether they all the way through what I call declination and loss of exclusivity from a patent standpoint. But we also work with them in terms of from a full service perspective. And so many times we're working with clients to actually help to define or refine their strategy. So how are they going to market? Who are the customers? Where? So we're partnering with them, and I would say that's really how we work with our clients today. Is in fact, it's not about that we're partnering with them, and I think that obviously gets to the best outcome at the end of the day. How can we leverage some of their what they've may have done already, leverage that, and then obviously go further, or even challenge or enhance the thinking to even look at potential opportunities within the market, whether by customer type or even just market factors, and how to maybe look at that a little bit differently. And then that ultimately helps to drive what I call some of the insights, how we're able to sort of understand those insights in the market, also from the competitive space, because again, we usually are competing with other products or services that other manufacturers may also be bringing to market. Because as you know, even with antibiotics, going back to the example you brought before, there are choices. There are different types of antibiotics that target the same bacteria. Why choose one over another? That could be by experience. That could be based upon data. That could be something, that you're just aware of that brand because of a constant brand message that's been delivered many times. So there's a whole host of factors around that, and so we work with our clients to help define those through what we're able to uncover from some of the research and understanding of that target audience or that customer type. Then that obviously is we're able to put forward ideas, whether creative ideas, or technology solutions, or engagement opportunities, or even experiences that will help to ultimately drive the objectives that we set out to achieve. And then, of course, what I would say is, at the end of the day, is that in the environment we live today, we're very fortunate that we have data. And so that data collection is able to see how well are our efforts working in terms of helping to overcome that, either that challenge, or did it deliver on the objective that we set out for? If not, why? And then when do we make that decision or the determination to make that pivot?
Okay. So any new things coming on the horizon for healthcare marketing? Any big changes, or it's really just business as usual going forward?
Well, I think that, I think if you asked, 10 different individuals, you'd probably get 10 different perspectives. I actually think that one of the areas that I think about is really about the power of the experience overall. And I think how do you create a exciting and meaningful sort of brand experience? And how does that actually have an ability to bring a customer into the brand and engage with it in a way that is meaningful from a content perspective, the storytelling that you're hopefully trying to establish. And I think that also, too, how do we look at, what were the aspects of, success? I think previously everyone, as you may be aware of, was very focused on aspects like return on investment. But what does return on investment mean today in a world where we're obviously looking at more than just prescriptions and prescription volume, but more importantly, it could be about brand loyalty. And so how do we leverage not only technology to drive that, but also create the experience that ultimately is that's going to be between that customer and that brand, and make that emotional connection. And I think that there's a whole host of different ways to do that. And I think that's a very exciting time right now that we're in, and that's what I'm actually really looking forward to.
Okay. Well, very good. So what's the best way for people to get in touch and to find out more about your marketing and what you can do?
Absolutely. Well, they're more than happy to get in touch with us. Our website address is evokegiant.com. They can reach out. My email address is currently there, as well as my phone number. Always happy to speak with anyone, partner with anyone. We're always looking to engage with new opportunities and new opportunities within the healthcare space. I think that we're at a very interesting space right now as well, from even looking at the world of outcomes. And I think that the other aspect that we didn't have the opportunity to talk about today is, beyond the regulatory environment, where else is the government in terms of looking at the ability to help to focus our efforts in terms of ensuring optimal outcomes for patients at the end of the day? And that's also a really exciting space to be able to look at, which I think has traditionally not been a focus within healthcare marketing space. But I think that today, more than ever, we are definitely moving towards improving outcomes.
Okay. Well, very good. Well, Eric, I appreciate you coming on, and now folks know how to get in touch. And thanks for coming on the podcast. Absolutely.
Thanks for having me, and I look forward to talking to anyone that's interested. Thanks so much.
You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you.